Hello, class. My name is Geoffrey Nighswonger, and I decided to go and do my teaching on beta blockers. And so my hope is that by the end of our little lesson here today, that you'll learn maybe a new thing or two about beta blockers that you didn't know before. So first and foremost is that beta blockers, the fancy way of saying beta blockers, is a beta adrenergic antagonist. It belongs to the drug class of beta blockers and the therapeutic drug class of antihypertensives or anti-anginals. There's also additional subclasses, which I'll talk about in just a second. But for today, we want to go and look at mainly the second generation, which is the cardioselective beta blockers. Other classes, we have our first generation beta blockers. These are known as being non-selective because they target not just the heart, but they target the kidneys, lungs, and muscle, as well as the respiratory system throughout the body. The second generation is known for being selective because they work mainly on beta-1 receptors. That's the one that targets the heart. But in higher doses, they can also go and work on the beta-2 receptors, the ones for the lungs as well. The third generation basically works on the heart as well as the vessels throughout the body, and it causes not just slowing of the heart and improving the contractility of the cardiac muscle, but also it goes and causes vasodilation in the vessels throughout the body as well. Hypertension, there are various causes and reasons for hypertension. It can come from, it can be secondary to a different disease or different condition. It's something that can be dietary. If somebody has a high sodium diet, it's going to go and cause them to retain water, which will increase their blood volume and can lead towards high blood pressure, as well as going and consuming foods that are high in cholesterol or fat. It can go and cause clogging, more or less, of the arteries and veins, and also hardening of the vessels, which will go and impact blood pressure. Environmental and lifestyle factors, go and look at something like smoking. Smoking can go and cause arteriosclerosis, the hardening of the arteries, which will go and increase the pressure in which the heart has to go and pump against. Lifestyle factors such as the smoking or a sedentary or active lifestyle. Anatomical features, meaning that sometimes people are born with different structures or different malformations of their heart, for instance, where they have a thicker cardiac muscle, or maybe their veins and vessels are smaller, or whatever the case is, that these can go and lead to hypertension. There's also belief that it could be genetic. There could be a genetic link to hypertension, but that one, there isn't as much support for that and research for that one. So the therapeutic goal of using the second generation, well, any of the beta blockers actually, is more or less a management of high blood pressure, because unmanaged high blood pressure can lead to stroke, can lead to damage to the cardiac tissue. So the therapeutic goal of the treatment is controlled and managed blood pressures. So the whole idea of the fight or flight response is something that's activated. It's called the sympathetic nervous system. And what happens is the body will release these catecholamines in response to stress or anxiety or exercise. You're in a scary situation, and this is when your body releases these catecholamines. Now, what these catecholamines do is they go and they attach, they bind to beta-1 receptors, and then that stimulates the sympathetic nervous system. Now, what the beta-1 receptors do when they're activated is it causes, basically gets your body ready to either fight or to fly, to run away. So it's going to go and increase your heart rate. It's going to go and increase your blood pressure. It's going to go and relax the smooth muscle in your airway to go and improve your breathing. So that's what happens normally. So the way that beta blockers work is they go and they try to block those catecholamines. They try to go and prevent the catecholamines from going and binding to those beta adrenergic receptors, the beta 1 receptors. So what happens is if they're able to go and to block those catecholamines, it's going to go and slow down the heart rate. So they're going to improve the contractility of the heart, which will go and decrease the oxygen requirement, the oxygen need for the heart. It's also going to go and decrease the cardiac output. So it's going to improve things. It's going to improve the blood pressure, decrease the heart rate, and it's also going to go and decrease the oxygen demand of the cardiac tissue, which is one of the things with angina, the lack of oxygen to the cardiac tissue. That's a different topic. So cultural considerations, as with taking any medication, it's really important whenever we have a new admission or a new patient that we do a thorough investigation as to what supplements and herbal remedies or dietary supplements that they have. Because a lot of times these medications or these supplements can go and interact with different medications, but a lot of people may not believe that these are medications. So when we ask them, are you taking any home medications, it's very common for people not to go and list some of the supplements that they're taking. So these are some of the supplements that can go and interact with beta blockers. So if you have a patient that is taking Lily of the Valley, we need to go and recognize that. Lily of the Valley is typically used for congestive heart failure. So is night blooming cereus. And both of these, when taken at the same time with beta blockers, can go and actually go and increase the effects of beta blockers. Now, this may sound good, but it's not necessarily good. It can go and lead to hypotension or bradycardia, which if it gets too severe, could be pretty bad. Fumitory, that's something that's typically taken or people will go and will use for an array of different things, such as infection or swelling, high blood pressure, or constipation. This one also will increase the effects of beta blockers, just like the Lily of Valley or the night blooming cereus. Ephedra is something that it may sound familiar. People have taken ephedrine for weight loss, but ephedra is also used as an antihistamine to go and help with allergies, as well as congestion. Now, this one, on the opposite side of the last three herbal remedies, will actually decrease the effects of beta blockers. So someone who's taking this along with a beta blocker may not go and actually benefit as much as they would from the beta blockers if they weren't taking it. And then there's a yohimbine, and this one is typically used for erectile dysfunction. This one can also decrease the effects of beta blockers. So it's very important just to go in to do a thorough screening whenever you have a new patient, just of what supplements they are taking, as these can go and interact with beta blockers or any medication. And they can either potentiate the effects of the medications or inhibit the effects of the medications. So very important for us to do a thorough investigation. Now, there's been a couple of different studies. Well, I mean, it's been more than a couple. There's been lots of different studies talking about beta blockers. Now, this was an interesting article. This one was based out of the UK. And what it found was that a lot of people were not very compliant with the medication regimen that they were given when it came to beta blockers as antihypertensive. So it found that when a new patient was given a beta blocker, that after the first year, that 27% of people stopped taking the medication. And by the second year, it increased to 39%. And by the end of the third year, it was 50%. And one of the main contributing factors was the fact that some of these patients were experiencing adverse effects of the medications. So they wanted to stop taking it. Additionally, you had to go and think about access to the medication. Some of these side effects, maybe they didn't understand the pros and cons of it, or maybe they thought that they were going and getting better. But I thought this one was an interesting read. just the compliance that some patients have. As many of us work in different areas of the hospital, I'm sure we see different people that are not the most compliant with their medication regimen or the pharmacological interventions that medical doctors have prescribed for them. Another study that was interesting was just how much people can go and benefit from the use of beta blockers in acute coronary syndromes exacerbations. And so this study was conducted, and it was looking at more or less the charts of 73,000 patients. So the study was conducted and basically showed that of these patients, when they were admitted to the emergency room and they were exhibiting signs and symptoms of an acute coronary syndrome, the ones that were given the intravenous beta blockers within 12 hours of arrival of those exacerbations, what the results were. And the results were actually, I thought they were great. They found that those who'd received the intravenous beta blockers, that they had a decrease in mortality rates by 8% than those who were not given it. And as well as it reduced the incidence of ventricular tachyarrhythmias. We said that beta blockers go and they slow the heart rate. They improve the contractility of the cardiac muscle. And also that it would go and prevent myocardial reinfarction. And so if you or a loved one are ever in the emergency room with presenting with acute coronary syndrome symptoms, I would be more than willing to go in to take a intravenous version of beta blockers. Now, this was the handout that I designed just to go in to give to a new patient, just to give them a breakdown and overview of beta blockers and the cardiovascular system. So the primary action is that beta blockers, they block the stimulation of beta-1 adrenergic receptors, beta-1 receptors. Now, there are quite a few potential side effects of taking this medication. As with taking any medication, it's important to know the pros and the cons and the risk and the reward. So it's very important for us to teach our patients that when they're taking this medication, they can go and experience fatigue and weakness, erectile dysfunction, insomnia, anxiety, depression, dizziness, drowsiness, memory loss, mental status change, nervousness, nightmares, blurred vision, stuffy nose, bronchospasms, wheezing, bradycardia, pulmonary edema, hypotension, peripheral vasoconstriction, constipation, diarrhea, increased liver enzymes, nausea, vomiting, decreased libido, urinary frequency, rashes, hyperglycemia, hypoglycemia, arthralgia, back pain, joint pain, drug-induced lupus syndrome. Now, interactions, as I said in a few slides before this one, is that beta blockers are known to go and react with lily of the valley, night blooming cereus, fumitory, ephedra, and yohimbine. And it's important, though, just that we do a very thorough screening of any patient with the medications that they are taking at home, or any supplements or herbal remedies, just so that we can go and look up to see if there's any cross interactions. Now, the hope is that when taken correctly as prescribed, that this medication would go and treat high blood pressure by reducing the cardiac output and improving the contractility of the heart. So that is the overall goal, the outcome that we are looking for with this medication. Beta blockers, the route, it can be administered intravenously or orally. For this particular handout, as there are many different types of beta blockers, I wanted to go and put a dosage. So I looked up atenolol. This is one that I feel like I see it a lot in the med-surg floor. And so atenolol, if it's being used for anti-anginal reasons, typically they will have 50 milligrams once a day. And now that can go and increase to 50 milligrams a day after a week. If need be. That should be under the advice and the guidance of a doctor. For antihypertensive reasons, this one's going to go and vary on a case-by-case basis. It can be as little as 25 to 50 milligrams a day, but if need be, that this dose can go and be increased to 50 to 100 milligrams a day after the second week of going and taking this medication. Now, it is important just to go in and know that typically high blood pressure, you don't want to go and attack it just with one route, one avenue. So typically, patients are given multiple different types of medications that will go and affect the disease, the illness, to try to go and hit it from different angles. So they may be on a beta blocker as well as an ACE inhibitor and a calcium channel blocker, so on and so forth. These are the references that I used, a few different textbooks, a couple different articles, and I hope that you all enjoyed the presentation. Thank you very much for giving me the opportunity to.